Hi, I'm Dr. Tyler Frew. I'm a board-certified plastic surgeon and breast and body specialist, and today I want to walk you through a mommy makeover consult. So you're going to hear from me what I tell patients during the consultation, the pros, the cons, who the surgery is for, the combinations of surgeries that you can have, but more importantly, the combination of surgeries that are right for you and will help you harmonize your body. So a mommy makeover isn't just a single surgery, it's different surgeries grouped together that are tailored for you, for your body type, and ultimately for the look that you're going for afterwards. So no two mommy makeovers are the same because no two people are the same and bodies aren't the same. They have similarities, but there are a lot of options inside the mommy makeover title. So let's start with your breast. Your breasts are either deflated, they need volume, they are either too low, so they need a lift, or in some cases they're too large, so we need to reduce them. These procedures can be combined with an implant, silicone or saline. It can be combined with fat grafting as well, or we can just use your own tissues. You don't necessarily need to have an implant if your breasts are being operated on. So let's talk about the breast reduction. So the breast reduction is because after childbirth, after breastfeeding, your breasts didn't actually deflate. They stayed rather large, they stayed rather low. So the point of the surgery is to make them higher, tighter, perkier, but also smaller. Now, smaller is on a continuum, and this is where you and I will chat about this a lot. What size do you think balances your body? What size do you actually want? Because we always want to keep you in proportion to your frame. There is another type of reduction called an autologous breast reduction. That's where we remove some of the tissue, but we keep around a certain percentage of the tissue, shape it like an implant, secure it to your chest wall, and actually wrap it in mesh to kind of secure it like a hammock. So another option is a breast lift, which is very similar to a reduction, but we're not taking as much tissue away. We're mostly tightening up the skin to pull the breast higher and make them more perky. The lift can be done with or without an implant as well. Another option for your breast enhancement, you can just need volume replaced back. Your skin after breastfeeding could have shrunk back around your body. You don't need a lift, you have no ptosis, so then we can just augment the breast to make them look more full. We would either use a saline implant, a silicone implant, or we could use your own fatty tissue. So there is multiple types of actual silicone inside the silicone implant. Some silicone implants are very soft and very syrupy. They have a lot of lower pole fullness. These implants look more natural. We have some silicone implants that are firm, they're more cohesive, the gummy bears. When you hold these implants up, they don't collapse. So these implants, when they go into the body, they give more upper pole fullness out through here, and they make the patient look more augmented. So there's a big spectrum of what the implant can be filled with. The implants also have different shapes, how wide they are, how tall they project out on the body. These are important because they translate to different looks once they go inside of you. Saline implants are a silicone shell then filled with saline. This will always kind of feel a little bit less natural than the silicone implant. The saline has one kind of thickness to it. We don't have those low, medium, and high tier gummy bears, so it doesn't always give you the subtleties of the different levels of upper pole fullness that you can find in silicone, but either one will give you a good result. So ultimately, it doesn't matter if you choose saline or silicone. You have to choose the one that's right for you, that you feel comfortable with, and that will get you the desired outcome or desired look that you're after. So it's really important that you come in, you chat with me about the look you're after, how natural you want to be, how much fullness you want, how much upper pole cleavage are all very important in terms of picking the implant size, shape, and filling. Now that we discussed the type of implants we have available, we need to talk about how we get them into place. So that's referring to the incision. The incision I always prefer to use is an incision underneath the underwire. This incision has been shown to have the lowest rates of infection and the lowest rates of capsular contracture, a potential complication with any implant. Now that we have the incision, we have to talk about, do we put the implant above your muscle, we're referring to your pec muscle, or do we want to put the implant below your muscle? And there's different pros and cons to each. It's really important that you come in for a consult and we're able to see your body, we're able to do the measurements, and we're able to tell you if you are a candidate for putting it above the muscle. The last thing we want to do is put it in the wrong plane for you that distorts your natural shape, doesn't give you the look you're after, and then ultimately, if we put it above the muscle and you're very, very thin, we have the potential for making you look too fake or too overly augmented. One thing we're always getting asked as plastic surgeons is, how is the scar going to be? How big is the scar going to be? Is it going to be noticeable? For breast augmentation, implant exchange, where we're taking it out through the IMF, the scar may be visible in the first month or two as the implants try to drop into position, but after the lower pool of the breast rounds out because of the weight of the implant, that breast will kind of shift down slightly and cover the scar completely. One final option is, if you don't like the implant route, but you still need volume, would be to use your own fatty tissue. This is called autologous fat grafting, and it's where we would liposuction a portion of your body, wash and purify the fat, and then we would inject it back into your breast. This overall is not as strong as an implant, and it ends up looking more natural. So if you're looking for a more natural approach without anything foreign in your body, this is definitely for you. And we can also use it in conjunction with implants as well, especially in women who have some small asymmetries in the breast size or asymmetries in their chest wall shape. We would still put implants in, but then we would pad the area or deformity with some fat grafting to give you better natural symmetry. One thing I want everybody to know is, don't come in with a specific cup size in mind or a specific number of cc's in mind. Those are really not as important as keeping your frame balanced and proportional. We measure you, I see your frame, and then we actually try on the multiple different sizes and styles of implants so you can get a good visual representation of what it's actually going to look like on you. The other big key or main component of the Mommy Makeover would be the abdominoplasty or the tummy tuck. So this usually involves some version of liposuction, whether it's just liposuctioning your interior abdomen or liposuctioning 360 all the way around. We will remove some fat from your torso to contour your shape, to make you thinner and accentuate your curves. The other main component of the tummy tuck is the excess skin removal, most likely from pregnancy and/or weight gain and weight loss. Another key component of the tummy tuck is the muscle or the diastasis repair. This forms during pregnancy. As the body's making room for the baby to grow, the muscles will slightly separate. When you give birth, the muscles don't necessarily come all the way back together, which leaves you with a bulging abdominal wall and a little bit weaker too, because your muscles aren't in the same position. When we do a full tummy tuck, we will repair the diastasis permanently, which puts the muscles back in the correct position. It strengthens your core and improves your posture. Tummy tucks do come in options as well. You can have a mini tummy tuck, which is basically a little bit bigger than a C-section scar, and it really only takes care of the skin and diastasis from below your belly button. Your belly button is not moved or manipulated in a mini tummy tuck. We can have a full tummy tuck, which is a scar from hip bone to hip bone usually, and we repair the full diastasis and we translocate your belly button as well. Or you can have an extended or 360, where the skin excess goes all the way around your torso and we have to flip you around on the table and you have a scar 360 degrees around your waist. It's tailored to what you need to get you the best result possible. One big question about the tummy tuck is, how big is the scar going to be? The scar is going to be long for sure, but it's going to be thin. There's multiple things we do in surgery to make sure the scar is thin, and one is putting reinforcing stitches along your abdominal wall down to where we're about to stitch the skin together in order to take the tension off, as well as doing photobiomodulation on the scar, which is a fancy word for specific wavelengths of light therapy to affect the scar and help reduce inflammation and help the cells heal faster. Another thing we will chat about during your Mommy Makeover consultation is what areas of liposuction do you need done for the goal that you're after. The most common type of liposuction I'm doing for a mommy makeover case would be liposuction 360 of the torso. So we would start on your back, we would do your upper back, mid back, lower back. It really helps accentuate your curves more, and it actually gives your backside the illusion that's a little bit bigger without having done anything to it. When we flip you around to the front, we're going to lipo your flanks for sure, around where your waist is, and where most women are holding most of their fat, right over the abdominal muscles. So by removing this fat, we make the skin envelope thinner. It's more likely to see the definition and the muscles underneath that you do have. We can also liposuction your arms. We can also liposuction your thighs in combination with what we're already doing. So sometimes patients ask me, do I really need liposuction? Can I just remove the skin in the tummy tuck for the mommy makeover? And you could do that, but the liposuction is really there to accentuate your results, accentuate your curves. And it's ultimately going to make your result look that much better. And it's not only just for your abdomen. Sometimes we actually have to liposuction in the lateral breast to give better contours and better shape, or we have to liposuction the superior axilla again for the breasts to give them better contours and better shape as well. Another big question that we have to talk about during the consultation is the recovery. What is this actually going to feel like after it's done? How long is it going to last? And when will you be back to your regular normal life? So let's break that down. The first 2 weeks after the mommy makeover are usually the time of the most pain, the most swelling, and when you'll need the most help. But you're not going to be bedridden, and it's not that you can't walk around and move. You absolutely can get up and down with some assistance, and you should be walking around the home. You really just shouldn't be at work for those times, especially if your job is very physical. You'll have your drains in, and you'll be in your compression garments. By the end of week 2, both of your drains will be out, and you'll almost be standing up straight. Even though those first 2 weeks are tough, don't worry, we're here for you. You'll be seeing us weekly, where we're going to help you with your compression garment, we'll help you with your lymphatic massage, and we'll help you with your scar care. One thing we do differently here in order to help our patients heal faster is that photobiomodulation. Before this procedure, to help clean the skin, right after this procedure, to help the cells repair, and during different phases of your recovery, to help decrease the inflammation, help the scar, and help your cells repair as well. So that wraps up our conversation on what the mommy makeover entails. When you come in for your consultation, we'll chat about your goals, your body, the areas that you want improved, and then we will develop a plan for your specific, perfect mommy makeover.